After my degree and master's, I started working as a consultant in human resource management in the healthcare sector. And this was basically because I wrote my sociology final dissertation on the role of a head nurse in the hospital world. That was in 2000. And after more than 20 years, I continue working as a consultant and project manager for the Italian Agency for Regional Services, AGENAS, in this field. In the meantime, I've made several experiences, first at the national level and then at European level. My first EU project I took part in was in 2013, in which I was a work package leader on behalf of the Italian Ministry of Health, and it was the European Joint Action on the Health Workforce Planning and Forecasting. As part of that experience, I had the opportunity to study and analyze the best health workforce planning systems developed by the European countries. And together with the project partners, we wrote a manual about them. And then in 2017, with some partners and friends of that joint action, we participated in a call for tender aiming to activate and manage a European network of health workforce planning experts. And our consortium was awarded. And so from 2017 to 2020, I was involved in the second project, in which I was in charge specifically to organize the support to member states that needed to improve the workforce planning system. And when in March 2020, the European Commission launched a call for proposals on initiatives to promote health workforce policies to mitigate the so-called medical deserts, well, it was quite evident for me to go for it and submit a project proposal built on the experiences and evidence gathered in previous project. And we named it Oases. Well, Oasis Project deals with the so-called medical deserts that are all those areas or situations in which there are barriers that limit the access to the healthcare services, or there is a lack of healthcare services compared to the population needs. From the patient perspective, it means, for example, to wait 6 months for a medical consultation or to travel more than 100 kilometers to reach the nearest hospital, or to have the family GP clinic open only 2 days a week. Solving this kind of problem is quite complex. That's why the European Commission decided to co-found projects that could investigate the factors driving to medical desertification and propose approaches to mitigate those deserts. As a consortium made up by 8 partners from 7 different European countries, we decided to propose a stepwise project structure that is quite simple. First, to measure with specific and robust indicators the healthcare professionals and providers available in a specific geographical area compared to the population demand of that area. And then to identify what we can consider as medical deserts, meaning to focus on those situations in which there is a lack or scarce or slow response to the population healthcare demand. And the third step is to analyze the factors driving to desertification and the possible solution to solve or mitigate them. This will be done also through the literature review. We are taking those first steps in the broader European context, but with specific references to the 7 countries involved in our project that are Cyprus, Finland, France, Hungary, Italy, Moldova, and Romania. And afterwards, in these 7 countries, we'll organize a consensus building exercise at the national regional level, focusing on the areas previously identified as medical deserts. This means a stakeholders discussion on the main antecedents and the possible solutions to the identified medical deserts. And then the final step will be to bring the discussion at EU level, involving the representatives of the Ministry of Health of the European countries. In the Oasis Consortium, there are 8 partners. Each of them has a great experience at the national and the European level, as they are deeply involved in the improvement of the healthcare system in their own countries. And at the same time, they have been involved in various European projects dealing with the health workforce planning and forecasting, health workforce education and training, or healthcare services analysis topics. Those partners are Agenas in Italy, Semmelweis University in Hungary, IRDES and the School of Public Health in France, THL in Finland, the Babes-Bolyai University in Romania, the National Public Health Agency in Moldova, and the International Network of Health Workforce Education as an international association. As Oases Project, we aim to turn the knowledge and experience of our partners in the shape of practical tools, methods, and analysis that can be used by all the EU countries to develop and implement workforce policies to support or to mitigate their local medical deserts.